Jamaica has a sick profile which is alarming but can be corrected, so says Minister of Health and Wellness, Dr. Christopher Tufton. Dr. Tufton says a large percent of Jamaicans have an NCD, a non-communicable disease, or a significant risk factor such as high cholesterol, obesity, or low physical activity. He said this as he gave his speech during the sectoral debate on Tuesday in the House of Representatives. Gabriel Thompson reports.
In 2016-2017, Jamaica Health and Lifestyle Survey indicated that 1 in 3 persons aged 15 years and older were hypertensive, 1 in 8 had diabetes, 1 in 2 was obese or overweight. Approximately 8 out of 10 Jamaicans had low levels of physical activity. These are trends born primarily out of historical lifestyle practices, and it will take time and a number of policy prescription and the commitment of all of us here in this House in order to cauterize and to change those trends.
The Health and Wellness Minister says while many are unaware and some just don't care, this must change as it affects all in the shared burden of healthcare costs. Quoting figures from the National Health Fund, Minister Tufton says we can't just throw money at the problem.
A close look at the budget of the National Health Fund shows that costs have escalated by 139% between financial year 15 and 16 and financial year 21-22. 4.6 billion in 15-16 and 11 billion in the year 21-22. And this is adjusted for COVID expenses. So, Madam Speaker, over that 7-year period, we have seen an escalation of cost. The additional projection for the next 3 years, which I've asked the health economists to give an indication based on where we're coming from, based on the trends, suggests that we will need another 30% or so increase over that period.
He broke down where most of the money is being spent.
In 2020 to 2021, the NHF spent $1.275 billion on hypertension drugs, compared to $940 million over the 2014-2015 period. In 2020-21, the organization spent $1.411 billion on diabetes, compared to $887 million in 2014-2015, a 59% increase. Madam Speaker, rising health costs are not just hitting us as a collective, as taxpayers, but it's also hitting us as individual householders, eroding our disposable income. In fact, the economic impact of rising health costs is absolutely devastating and projected to get worse.
Minister Tufton says that even pharmaceuticals are up.
And I'm just taking out 10 of the critical pharmaceuticals. There was an increase in the price of these drugs, Madam Speaker, between 2017 to 2022. 8 of the 10 drugs under consideration had price increases of more than 100% over the review period. Examples of the variation in commonly used pharmaceuticals include paracetamol, 785% increase, dextrose, 5% in normal saline, 87% increase, and morphine powder, 117% increase. Madam Speaker, this is absolutely unsustainable.
Dr. Tufton notes that it is important to restructure the health system now to achieve a more sustainable mechanism and identify how it will be financed.
In the coming months, Madam Speaker, I intend to unveil a discussion paper, ministry paper, on sustainable financing options for our health system and embark on a series of consultations within government and the country, as well as with our multilateral partners around healthcare financing. This is a follow-on, Madam Speaker, on the Green Paper on a national health insurance plan that was tabled back in 2019, which was not pursued as desired due to the priorities of COVID. Madam Speaker, I have appointed Dr. Damian King, an economist and executive director of CAPRI, who was the chair of the National Health Insurance Working Group, which led to that Green Paper, to lead the national discussion on the current challenges we are facing with health financing and implications for poverty and the economic and social advancement of Jamaicans.